We continue the conversation now with the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, who you've just seen. Thank you so much for joining us, Minister. No doubt a moment of pride for you, this program starting in 1996. But as a department, if you would just review it, I believe it's produced 2,556 doctors. Is this number accurate?
Good evening, Ms. Makwetla, and good evening to the viewers. It's 3,071 that to date we have, with this 254 that graduated 2 days ago. The number is 3,071, and 46 specialists out of that program we have to date.
Okay, and what kind of specialization are they involved in? Because we heard what some of those who have now finished qualified have said were the struggles that they had, but the benefits of having to study in Cuba.
One of the best, and we are proud of this, is a cardiothoracic surgeon and a female, black female for the first time, and Dr. Popira Matuba in Limpopo is ever proud. She always talks about this because that lady is based in her province. There's been various disciplines on which in fact, I think one of them, the only critical forensic pathologist that they do have at Sefago Mahato University in Pretoria is a Cuban trained specialist. So they've gone to various specialities, and all the specialist gynecologists, all that you can name them. I do not have the whole list of these 46 that they've gone into these various disciplines in the country. Thanks.
And we heard that they study in Spanish, that it obviously would have proved difficult for some of them at the beginning, but in the end they feel it would have helped them along. And perhaps if you could just explain to us who aren't doctors or in the medical fraternity, is it because of the Latin influence when we look at the medical sciences? You know, what is the importance thereof, and what can they come back and teach their fellow students here to say these are the benefits that we've acquired, the knowledge that we would like to now transfer back home?
The background to this, Ms. Makwetla, was that when the national liberation struggles were actually won in 1994, further discussions that took place between President Nelson Mandela and President Fidel Castro was, can you support us with the medical doctors to come and support what we are really strained in the most difficult rural areas, far-flung. But that happened, and we then had the brigade that came and supported us. But over and above that, President Fidel Castro said, we can now assist you even to train your students, bring them to Cuba. Like many other countries in Latin America, they bring them to us, we support them. So the medium of instruction there is Spanish, because a large number of them are. And they were also going to be integrated to the other students from all other countries, including the Cuban students, into one class. And therefore, hence, when they go there, they get reorientated in their first year of Spanish, and then they pick it up and get into the first year of medical training. When they come back, Ms. Makwetla, they don't only come back with a degree, as you have seen now in your pictures completing, but they come in with this new model of a primary healthcare focus, where they actually, during the course of their training, go out of the classrooms into the community. They follow a patient up to the home and see what actually is the prevailing conditions that make that patient to have what they have. We have specialists in Cuba working in the clinics, among other things, to say, if we have to prevent diseases, if we have to prevent patients getting amputation of the feet in theater because of complicating diabetes, we as specialists must go and be in the community, in the clinics. So that is what actually these students, as doctors, come back and say, Dr. Dhlomo, can you take us away from working at Chris Hani Baragwanath Hospital, but take us to the far-flung clinics closer to the people? Because after doing my work, I would want to visit that community, that household, and check what actually brought this condition that they have. So they are bringing something which is extremely new, this which we call community-oriented primary health care.
And if we were to talk about that, because there have been some suggestions that these doctors would need reframing when looking at primary and private healthcare in South Africa. But I've actually observed some of these Cuban doctors that you speak of work in emergency situations, flown in a crisis situation with them, where there's been no equipment, no medication, and they've actually been able to help people. So it was quite fascinating to see. So you're saying this are some of the things they bring to these far-flung areas?
So you probably recall that the world was engulfed with COVID, and the whole world, including South Africa, Western Cape also, benefited from the specialists because of their training. They actually are the people who are actually used to dealing with such pandemics, or have a whole host of disciplines: epidemiologists, virologists, microbiologists, all specialties that we sometimes don't have in our country, who were available to then assist and support the whole world in terms of combating COVID. So this is the cadre of lecturers and specialists who have trained our doctors to be oriented towards knowing to say the community has these diseases, but what brought about these diseases? Go into the community and identify and do a community diagnosis, and therefore be able to provide solutions. Some of the solutions are not medical, some of the solutions are economical, and some of them are political, like making sure that you do not have clean water. That is why they've eliminated so many diseases in Cuba. There is no cholera in Cuba, there's no malaria, because they now know that if you have to eliminate this, that, and the other, among the things you must intervene in this way, and not only intervene by giving tablets, but they are also a community that is very health-seeking behavior type of attitude. All those things to impress upon the community for them to really do. So that is what they bring to us, and that is the flavor of the medical training that we don't want to lose. Hence, we are saying if it's difficult and probably expensive to take the students there, we rather than bring those Cuban lecturers to support us in our shores and actually orientate us and help us to really exit with a degree that has got a much stronger emphasis on community orientation types of approach.
So while we celebrate the positives, Dr. Dhlomo, there is the reality, the fact that the graduations of this new cohort of doctors is after almost the same number of locally new graduated doctors are still waiting to be placed in public health facilities. So what is your comment on that? How far is the pace of doing that? And there is a major backlog, which I know the health department has itself admitted.
Already the 254 that were there are already placed in hospitals, except for 40. There is another just 40 that joined us because they did their exams 3 weeks ago, and those ones are the ones that will be placing. But all those that were graduating already are coming back from hospitals. They are already in their program. So they wrote their exams in December, so they were now just coming in for the graduation, because we had to really plan it with the Cuban government. But it's not that they are not placed. About 200 of them already know where they're working, and in fact, you could speak to them yesterday. They're telling me, I'm coming from Tembisa Hospital, I'm coming from this and that hospital. So we were with them there yesterday, and they were telling us they're not really strained, except the 40 that finished last week. 2 weeks ago. We will be placing them soon. Yes.
Yes, but I'm also asking about the ones that remain unplaced here locally in South Africa who did not go to Cuba. And the fact that you actually have, if we look at the current country doctor to patient ratio, and you can correct me if it's not correct, that it's said to be at 1.3 per 198 patients. So there is a crisis in our health system.
There is this issue. There are certain doctors in the rural hospitals. We try all what we have to make sure we have doctors who go there. But there are doctors who make choices to say, if there is no space at King Edward VIII Hospital at Chris Hani Baragwanath, I will wait for the second round or the third round, or next year I'm not available to go to work in Nongoma Hospital. Now, for whatever reasons, so we may find that everybody is gunning for urban hospitals where we may probably be almost optimally covered there. And the rural, that is why even to date, rural hospitals have always been supported by foreign doctors, largely from Cuba and other countries. Well, some of us who trained in the country, few as we may be, we just think that I'm not available to go to work to Ikopo, Nongoma, and Toyando. So I might actually, we always say, if there's any doctor who is left without a job, let them come forward. But it must not be a doctor who said, I'm not available, I'm waiting for King Edward slot. There may just not be any availability at Inkosi Albert Luthuli Hospital tomorrow, because we have taken the whole lot. But if we then say there is a space available in Mankweng Hospital, go to Chilizini Hospital, then suddenly people are not available or reluctant to go there. So I would really be appraised by that list. I'm glad to see it, and then you can work on that list. If there's any doctor we have not placed in the country for whatever reasons, but there is an availability of space in our rural hospitals.
All right. Thank you so much for speaking to us, Dr. Sibongiseni Dhlomo, who is the Deputy Health Minister.